With popular demand, we have really called Dr. Satish Kamath back onto one individual
Okay, we're live now. Meeting. Meeting.
Hello, viewers. Welcome to one more show of Truwellth Facebook Live. Um, I'm, of course, here with popular demand with Dr. Satish Kamath, and I'm giving you a quick introduction about our show as well as Truwellth. Um, it is a COVID lockdown, and with popular demand, we have really called Dr. Satish Kamath back onto one individual show as cancer and chemotherapy, or in treatment and palliative treatment around the disease, is the most difficult and anxious time for the cancer patients, and of course also for the doctors who are treating them. Um, that is why he is really here to tell us more as to how we can take care of the cancer patients and manage through their chemotherapy appointments and schedules. Just to give you a little bit about Truwellth, Truwellth is an integrative healthcare initiative guiding patients and healthy individuals to overcome the health concerns and manage their self-help to reach the ultimate goal of holistic health and happiness. Truwellth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. Truwellth's ultimate goal is to provide integrative and personalized health and nutrition advice to achieve health and happiness. A quick note before we begin with the program. This Facebook Live program is organized to get more information and guidance to keep health, nutrition, and fitness during lockdown. The recommendations made by the speaker and other participants cannot be treated as consultation. For personalized consultation, you can reach our consultants on 98200, or that this program is not really intended to provide COVID treatment. So you can approach the hospitals and doctors assigned by authorities to get authentic information on COVID. On that note, I'm going to introduce to you uh, Dr. Satish Kamath, who's right here, and per me, how I would introduce him, and I'm sure he won't like it me saying that, but when we actually shared invite of these programs, one of my friends, and I would mention his name also, Ashish Adhikari, came forward saying that he's God. And when I said to him that yes, Dr. Kamath more than just a great oncosurgeon, is a great human being. And here's what he said. He said I called him God, and which is what I mean. And that word says it all. So I know I'm sure Dr. Kamath will not agree with that, but here's what I want all of you to know, that we have a great human being and of course a great oncosurgeon, Dr. Satish Kamath, with us. Uh, he um, he runs the Asha Cancer Hospital and Children First Hospital in Thane. He of course is highly trained and experienced in oncosurgeries, but apart from that, he does a lot of philanthropy. He's into organizing conferences, speaking at multiple conferences as well. So you would actually, I mean, I would actually want him to really talk to our viewers and patients, who are in a situation. How do they deal with cancer as a situation? Because I'm sure a lot of us have some or the other person going through this pain in the family. I've had already have had people telling me on messengers where we have been sending our invites that I have a friend who said her father is 80-year-old and is going through chemotherapies in the village. They're not even able to meet them or go there to treat them, and there's so much anxiety around this whole thing. If you could actually enlighten us with all your experiences and how to actually go through this situation at present, and also post it, how do we go about managing our relatives who are suffering from cancer? Over to you, sir.
Good evening, everybody. Rajashri, thank you for a very, very big introduction. And I really don't agree. Like I said, it's my philosophy that we have to return back to society what we have gained through our knowledge and improve the society so that it becomes better for the future generations. Today, with COVID cancer coming in a big way, there's a lot of miscommunication, lot of misinformation, what is to be done, what is not to be done. We are also learning as doctors what should be done and what should not be done. Initially, first few days, everything was stopped, no treatment, nothing. Then we realized, boss, we can't wait. We have to continue treatment. There is no way we cannot treat the patients. So then there were changes and new guidelines by ESMO, ASO, and all those American Association and European Association, and even the Indian Association of how to proceed along this emergency scenario. The other day we have spoken on surgery and radiation a little bit. So today I think we should concentrate on chemo. But today I would like to give us two brief overview on cancer, COVID, chemotherapy, and management in the scenario. So we'll start the same.
Sure, absolutely. We are waiting for it.
Okay. Okay. Cancer, chemotherapy, and COVID. So basically, if you see this image, this is the right side is the upper part is the cancer cell, and the lower part is the COVID cell. They look nearly the same. That is the scary part. In fact, the only difference between the two is COVID spreads from person to person, whereas cancer spreads inside the person. That's the only thing I realized. It doesn't spread from person to person. Otherwise, all the future slides, you'll realize that COVID and cancer nearly have the same symptomology and same thing. So basic, let me give one basic thing. Cancer is benign and malignant. Benign is basically not cancer. These are small tumor cells which grow only locally and they don't spread or go to any other part of the organ. So these are like in the breast of fibroadenoma or in the uterus or fibroid. These are all benign tumors. And malignant tumor or a cancer is a cell which goes into the surrounding tissue and it enters blood vessels, the lymph nodes, and spreads to the other areas. So that is called as malignancy. So why does cancer occur? The first and foremost cause when we can always see is tobacco. Let's be very frank, tobacco and tobacco products are the number one cause of cancer. Excess weight, obesity, diet, lack of exercise, family history, viruses. Again, if you're reading this virus, don't get scared. Luckily, today COVID doesn't cause cancer. There are other viruses like hepatitis A, B, C, and Epstein-Barr virus and other viruses which cause cancer. So we should know all these things. Then there are different stages of cancer. There's stage 0 to stage 4. Stage 0 is just early or maybe a start, that is called as the in situ. 1 is localized, 2 is little spread to the sides, 3 is little late, and stage 4, it has gone to the other organs. Now, depending on the stage, the treatment is given. Normally, stage 0 and stage 1, many times in a solid organ, surgery is enough. But stage 2 onwards, the main theme comes into protocol, what is called as the chemotherapy. Till the COVID crisis, chemotherapy was given left, right, and center with very good results for patient recovery rate increasing from 40% to 70, 80, 90%, depending on the type of the cancer. But like everyone knows, chemotherapy has its side effects. So this is the type of metastasis, what we were saying. The primary cancer may be in the lung or in the breast or in the uterus, but then it can go to the bone, brain, and other adrenal, liver mets, and all those things. This is metastasis. So what are the treatment options? The first and foremost is the diagnosis. For diagnosis, we do multiple tests, but the most important diagnostic tool is the biopsy. Some sort of biopsy is required before we can proceed with the treatment of the cancer. Now, with the COVID scenario, even doing a biopsy is tricky for us doctors. So this I'll discuss a little bit later on. Then depending on the stage, we have started doing surgeries. Initially, for GI and thorax, we were avoiding laparoscopic surgery in the present COVID scenario. But luckily with new advances, with newer ways of managing the carbon dioxide release and better management of aerosols, HEPA filters and all those things, now we have slowly restarted doing laparoscopic surgery, but only in select surgery. Chemotherapy is the golden standard. Whether to give, how to give, I'll describe later on. Other options are radiation, immunotherapy, and most important, nutrition, yoga, and exercise. These do form a very important part of management of cancer. Neglecting those two parts, the upper part cannot be useful. Rajashri, I would like later on want you to talk on nutrition.
Sure.
So let us now concentrate on chemotherapy. Chemotherapy is basically giving IV or oral medicines which destroy the cancer cells. So we could see the cancer cells healthy, well-differentiated, uniform growth, whereas the cancer cell is uncontrolled growth which are damaged. Then we put the chemotherapy medicine and the cancerous cells die and the healthy cells remain. That is the basis on which we give the cancer cells. How does this cancer cell do it? It prevents the blood supply, it stops the cell division, causes spontaneous cell death, and prevents the division of the cells. Now, this looks very good in the picture, but the problem is in chemotherapy, not only the cancer cells, the normal cells are also destroyed. That is called as collateral damage. So when there is collateral damage, you have the massive side effects which occur. So what do you expect in chemotherapy? Normally, this is the way a IV is given, IV through the bag, through the PICC line, or a chemo port, a syringe, needle, and everything. And depending on the protocol, it can last from 5 hours to 12 hours to 2 days, 3 days, depending on the protocol. So what I was telling about is the side effects. Most common being vomiting. Everyone, each and every patient has had vomiting sometime or the other. We do use good antiemetic agents, but still vomiting is the most important cause. And then unfortunately is the hair loss. Of course, we can later on manage the hair loss part, but that is also an important part. Nausea, vomiting, fatigue, and diarrhea. Now, these diarrheas and all occur, sorry, what is important is this is what when the bone marrow gets affected and there is weakened immune system. Now, this is where the catch 22 comes. When this immune system is weakened, COVID-19, if it enters the picture, it is going to increase all these multifold. So whether to give chemotherapy or not, which protocol to do, what are the safety precautions to be taken, have now evolved over a period of time. So this is the side effects which occur because mainly of anemia, which causes fatigue and short of breath. For anemia, the simple thing is we have to take good diet, especially beetroot, carrot, and high protein diet, which is very, very important. And doctor will give necessary injections. In the present COVID scenario, this part, transfusion and erythropoiesis stimulating agents may be slightly higher compared to normal times. Then is the most important thing which occurs is the neutropenia. Now, when neutropenia occurs, that is the WBC count going down, the whole Mahabharata occurs in the body. We have seen that in the Mahabharata war, everything is destroyed. And this neutropenia, when it occurs, it affects the lungs, the liver, the GI system, then the oral ulcers, loose motions. Even in normal times, it is difficult to manage. But with a COVID scenario, it is far more difficult. So that is the reason initially, and even now, we are very careful of giving chemotherapy in the present scenario. Thrombocytopenia is the lack or reduction in the platelet count. And so, how do you tackle this? The simple thing, again, I said, exercise. Now, you cannot go out of the house, but at home, one should not do bed rest. One should be walking around. If you have a cycle in the house, exercise cycle, and simple PT exercises which we used to do at the school. Prioritize your task. Take proper naps. Sleep is the most important antidote both for cancer and for COVID. So one has to relax, have a proper sleep, and last part, which I said, eat well. But that is again a catch-22 now, but that is the most important thing. Now a little bit about COVID. It looks similar. What is COVID? COVID is a virus, which is actually from the corona family, which is with us since donkey's years. The simple cold or the flu, the SARS, MERS, which we have heard, has been since 1960s plus, and it is majority of time self-limiting. What makes COVID dangerous is very infectious, and it spreads very fast. So it is very dangerous. What are the symptoms? Fever, shortness of breath, and cough. These are the three most important symptoms. So that is why now you must have realized that whenever you go for a mall or shopping or anything, the security guard is first checking the temperature. So as soon as there is temperature, one has to compare with the other things and rule out a COVID. So fever, cough, breathlessness is the most important part, and other important part is the sore throat. The most common way it goes through the nose and the oral cavity. So that is the thing. And the last part which I have written, loss of taste and loss of smell. This is very important for COVID. In cancer, all the other things occur except the loss of taste and loss of smell. So this is very important. Now, if there is fever, should we all get scared that we have COVID? No. This is a simple analogy which is given by everyone. One should not forget that there are normal causes of fever existing in the society. So once person gets a fever, it doesn't mean that he has COVID. They have to be managed depending on the symptomology. What is the treatment of COVID? Most important is hot beverages. Drink hot water, gargle with hot water and salts regularly, read soup, have a thermometer at home to monitor, and just take Prosil to reduce your fever. Cough drops, and this is very important. I think Rajashri has a very good nutritional supplement, vitamin C and other thing, which is very, very useful in this time.
Yeah.
Keep a lot of tissue papers with you to, and most important, isolate yourself and don't mix with other people in the house or in the society. And most face mask. This is the thing of the future. Today I'm alone in this room, so I'm without a face mask. Otherwise, wherever I go, I'm with a face mask. So a time will come where we will not recognize each other. In fact, we recently saw a T-shirt with a photograph and the name. I think we'll all have to start wearing it. I am Satish with a photograph on the T-shirt that way. So going back to cancer, chemo, and COVID. Very important line. COVID does not stop cancer. And so cancer treatment has to continue. One cannot halt cancer treatment. There are a lot of routine planned treatments which are stopped. No one is doing hernia surgeries, which unless it is emergency. No one is doing a routine weight loss surgery. So much so that even surprisingly cardiac arrest and other patients are also not reaching the hospital in time. But that is the surprising part of why this is happening. Though I'm sure that is there in the society, but it is not being recognized and not being treated. But somehow cancer treatment has to continue. Now, when there is COVID and chemo side effects, this is what happens. All the symptoms are the same: fever, cough, breathless, diarrhea, sore throat, fatigue. So when a patient of chemotherapy gets this, we don't know whether the patient has chemo toxicity alone or associated COVID. So this is where we are at a risk. So for all chemo patients, we advise doing COVID-19 test, and also we get a CT scan of the chest because it affects the lungs. The CT scan of the chest is now more diagnostic because COVID test, that is the RT-PCR, which we do, nasal swab and throat swab, is only 63 to 70% sensitive. 30% cases are missed by the test. So CT scan of the chest is done at least once, especially even in an asymptomatic patient. So what are the changes which are done in the chemotherapy now? First and foremost, initially we have reduced the dose so as to reduce the side effects. The prolong the interval. 2 weeks, we have made it 3 weeks, 3 weeks, maybe 4 weeks, increasing the interval between the two doses, maintaining distance. Now, this is very important, which is happening in all the hospitals. A general ward concept is now over. We have to have private or semi-private wards so that each and every bed is isolated from the other bed. One cannot have 10 patients sleeping beside each other as they are taking the chemotherapy, and there has to be strict isolation between the two patients. Fourth part, that is no relatives, especially in India. Along with the patient, we have realized a lot of 2, 3, 4 relatives come. They sit with the patient, holding the hand, talking and doing everything. So now it is a strict hospital policy that patient has to come alone or maximum one patient relative. No second, third, fourth relative is not allowed. One, for the safety of the patient. Second, for the safety of the staff and the doctors also. After chemotherapy, proper home care. When the patient comes, he has to be wearing a mask. They should be washing their hands regularly. It is very, very important. Anything is done, wash your hands. Best is soap and water. Mind you, a lot of people are just buying sterilium and alcoholic things. That is okay for a short time, but more important, wherever possible, wash your hands with soap and water. These patients, even at home, after the chemotherapy, 7 days or 8 days, they have to wear the face mask, even in the house. There is no way they go out of the house, that is understood. If the house is big enough, ideally for first 4 5 days, they should be isolated, and others also don't visit the patient quite often. Proper precautions by patients and relatives, that is again important. Lockdown will be closing maybe this month or maybe June. Let's hope for the best that it closes fast. But that does not mean you start rushing around to visit the patient. Because whatever wishes or things to be done should be done by telephone. Telephonic consultations, video calls, audio calls, WhatsApp, these are the things which are very important for the modern generation. Extra supportive medicines are prescribed in the form of giving higher dose of vitamin D, vitamin C, B complex, and protein supplements so that the patient, when he's already taking less because of the chemo side effects, has to take proper nutrition. Because if the nutrition and the diet is poor, the side effects are more. A proper nutrition and exercise, a simple exercise that is not going to the gym, but at home doing a simple pranayam, Surya Namaskar, or basic stretching exercises or breathing exercises. Most important is breathing exercises. Just like my friend doctor has told me, we use only 50 to 60% of our normal lung capacity in our normal breathing. 30 to 40% of our lung is not used. Then when we start exercising, that 60, 70 becomes 80 to 85 to 90%, depending on the strenuous exercise which you do, the sporting exercise which you do. But the last 10% is still not used, for which you have to do dedicated breathing exercises. That is important. Nutrition part, like I said, Rajashri is the expert and she will discuss about it. The other important changes what we have done is, as far as possible, we have started giving oral chemotherapy to reduce the patient coming to the hospital and to hopefully reduce the side effects. Oral chemotherapy does not mean no side effects, mind you. It is not an inferior treatment. They are given for select cases where they are available and they have equal side effects. In fact, in this present scenario, there are some oral medicines which we have stopped prescribing because they also have side effects like chemotherapy. So oral chemotherapy is preferred over IV so that the reduction in coming to the hospital, and overall, the side effects of oral chemotherapy are slightly less compared to the IV. And if there are side effects, you stop the drug, the side effects recover. In breast cancer and prostate cancer, endocrine therapy, wherever possible, is the mainstay. No chemotherapy if it can be avoided. 11th point which I have written, avoid unnecessary visit. Now, so we have had patients, we have called patients every week to do blood tests. We have called patients every 2 weeks, 3 weeks to come and see how they are, how their pulse is, how is the tumor. We have been repeating sonographies and PET scans and other things to see the progress of the disease. That is now curtailed to wherever symptomatic. If symptomatic, you have to go to the doctor. If they are asymptomatic, one has to manage with the one's own symptoms. If there's a breast lump and it is reducing in size, great, no need to come to the hospital. Continue the therapy. If there's one, basically, you need not document the response frequently. You have to document it maybe after 3 months, 4 months, or 5 months. But till that time, it will be a clinical judgment. If the patient is doing well, eating well, moving well, and has no symptoms of cancer, we avoid calling the patient to the clinic. And this is where the last part, which I said, telemedicine. Truwellth has also started the same. Other agents also started the same. Doing a telemedicine, discussing with the patient on the phone, on the video call, and giving, if necessary, prescription with proper channels is the way forward, at least till this acute crisis gets over. At the same time, cancer is okay. One should not forget managing their other comorbidity like diabetes, blood pressure, psychiatric illness also has to be managed at the house level with proper respective doctor's opinion. One cannot say I'm taking cancer medicine, so diabetes, bye-bye. One has to control diabetes. Now it's the mango season. I have had patients eating mangoes and coming with a sugar of 300, 400 along with chemotherapy. That is disaster. One has to take control of your life, maintain discipline, and control diabetes, in fact, more vigorously, because that will cause more problems if chemo-induced side effects occur. One very important thing which I have not told in COVID was who are high risk to get the COVID and developing complications of COVID. The first, unfortunately, are we doctors and healthcare workers. In spite of whatever the PPEs we are wearing, our mask and everything, we are unfortunately at a higher risk because we are in direct contact with the patients. And patients also hide the symptoms. Please be open. If you had a history of fever, don't take a crocin and come to see the doctor. Please let the doctor know that you have fever, you have cough, so that necessary treatment will be given. It has happened that patients have not been given, had delayed therapy because of fever, and doctors also panicking and not managing because of many rules going up and down, shutting down of hospitals, then opening of the hospitals and all those things. But now, luckily, things are getting streamlined. Don't hide your symptoms from the doctor and get treated ASAP. Most important thing is 80% of the COVID patients recover fully. Of the 20% who get admitted in the ICU, more than 15% recover. It's only the 5% who are senior citizens, who are diabetic, who have other comorbid, smokers, and who have cancer, who are on active treatment or metastatic disease. They are at higher risk for the response and side effects. So very important that this has to be managed in all dimensions. One cannot just say, I'll take chemo and forget it, or I will not take chemo and forget it. We have had patients in these 3 months who have progressed because we could not give chemo in time in the last month or so. The other important factor, which is unfortunately now there are no traveling possible because of no train. Even the bus is only for essential services. So luckily with our letter, if you have a vehicle, patients are allowed to come to us. If it is not possible, one has to go to the local doctor concerned and do telephonic consultation and take treatment at the local doctor's place rather than not taking any treatment. These are the very important changes which are there to stay for at least next 3, 4, 5 months till we have a more better cover and we conquer the COVID. Now, this is the scenario which is going to be the future. Whenever you come to the hospital, don't be surprised to see a team of doctors dressed up like this in spacesuit. You will think, I have entered Mars or what? No, you are not in Mars, you are in Earth and you are in the hospital. Your doctor team may be like this or a variation of this sort. And this is very important for the protection of the doctor and the staff. And on your part, on the patient's part, this is the basic necessity. At least a simple mask has to be worn. One cannot come without a mask in the hospital. That is important. Now, here a important part, because of the mask, many times we don't recognize each other. The patient does not recognize the doctor, doctor does not recognize the patient. So one has to talk to each other, taking out the name. And one, even for us, as we give the treatment, we have to double check the therapy is given to the right patient. So this is very important thing because पर्दे में रहने दो बोलेंगे तो सब पर्दे में रहता है, फिर तकलीफ होती है. So this is very important from our point of view, even from the patient point of view, that one has to address the doctor by name, and one has to tell what is your name and everything, who is the patient, in the proper way. There is no way that one can, doctor knows, patient knows, that should not happen. So how do we deal with these complications? I already told you, most important is oral gargles. We give betadine gargles or whatever, but at home, simple hot water gargles with salt in it is good enough. 2-3 times a day is adequate. Again, proper cleanliness. In all this thing, the most important thing which is going to save the person is cleanliness, and cleanliness of the hand. Joseph Lister was the first person who taught us hand washing brings down the operative mortality, and that is now coming true. One has to wash hands, not only the doctor, all the patients, the relatives, frequently wash the hands. We have, unfortunately, we don't, many people don't wash hands after going to the toilet, many people or whatever. Those habits have to break. One has to wash the hands, period. A clean hands are a must. Face mask is very important. A cancer patient should wear mask even in the house. Not because he will get it from the air, but the other people, relatives, they go outside for vegetable shopping, getting milk or medicines or anything. They can be what is called as asymptomatic carriers. So even in the house, the patient has to be wearing a face mask. Hot food, very important. One cannot take cold. Avoid all ice creams and very cold drinks and things from the fridge directly. One has to heat it up and take hot items. No raw food. Rajashri always tells me that please tell this, that raw food should not be taken. Cucumber, beetroot, everyone likes it. Kachak kha liya. But no, you have to clean it in water properly, maybe skin it, maybe boil it a little bit and then take it. Once hot, this so-called raw salad, unfortunately, should not be taken without proper cleanliness. It should be a little bit boiled or heated before you take it. That is very important. Stale food is a big no. Of course, stale means nowadays, unfortunately, we have to cook only once a day, so up down hote. But today's food, tomorrow, a cancer patient should avoid. Adequate water intake. Whenever, even before the patient, we have been telling patients that at least 2 liters to 3 liters of water intake is a must, because all the medicines which we give, all the byproducts which come out of the medicine, they are passed out in the urine. If you have a proper urine output, the side effects are less. Now, patient doesn't go out of the house. Everyone is in the house, so they don't drink water. There is AC is on, the fan is on, you don't feel hot, so you don't drink water. And that is where a cancer patient should drink water by the clock, not when he feels thirsty. He has to drink by the clock, and again, if possible, a proper aquaguard or a boiled water. That is important. Colored food. This, I think, leave it to Rajashri. Different colored food. Colored food doesn't mean you call it sun and color them, but she will tell you explain. Vitamins, vitamin B, vitamin C, vitamin D, and even vitamin E. These are very important to manage. Last, sun. At the moment, we are not allowed outside, but if you have a terrace or something, go in the morning. We have a clear sky. First time we are having without pollution. Take sun so that you have vitamin D and improve your immunity to fight the disease. So together we can conquer both the seas. But seeing these two, one should not forget, even in today's generation, cancer is still the big C. Thank you very much and open for questions.
Okay, so we do have a few questions coming up. Uh, would you want me to first go over the nutrition bit quickly and
Yeah, yeah,
then
yeah, yeah.
ask the
Definitely.
questions.
Yeah.
Though, you know, we are already getting comments from Dr. Patil saying that fantastic session. Dr. Jeetan Bendur is also finding it very interesting. So we are already getting some comments in from there. I'm actually going to share my slides a little bit quickly, and a lot of important inputs did come from Dr. Kamath himself, and I'm a big fan of his because you know he always emphasizes on nutrition, and he is very in depth about it already. So that's one thing which is great. So here, to take a quick look, what he just said that no food safety right now is most important, and if you see these guidelines are always there for cancer patients, and right now cancer patients we are following your routine, so welcome to your world actually. I'm sure most of you are following this. You know, washing hands has been like everywhere, but you know make sure that when you're the cutting boards or the utensils that you're using are thoroughly, you know, after you're cutting it they're thoroughly washed and kept separate. Once you have cut vegetables, right now these things are important. Once we cut vegetables, immediately put them for cooking, and that way, you know, keep any sort of infection away, you know, small things, but and like Dr. Kamath said, eat hot food, avoid cold foods, yes, avoid ice creams. Even if you land up making ice, use boiled water, ice made out of boiled water. I would suggest, in terms of dairy, you know, most of the products we should make sure they're pasteurized. So get carton milks. Don't avoid the milk which we get in bags or loose. Uh, Yogurt or dahi which we eat, it's ideal actually to make it at home because the active cultures are in best state that way. This gives you a good amount of lactobacillus and probiotics, which help in digestion. Do not drink raw milk though. We have to make sure that all these things should be kept in mind. No raw oatmeals, even if you're eating cereals, they need we need to make sure that they are off infections. And then ice creams again, if you just have to or you're craving one, try instead of that, try to make something like a maybe like a cream which is not frozen, but you know, instead of eating a mango ice cream right now, you can eat a mango cream. So it's a little less colder, and it won't. We always have these bacteria and virus sitting in our throat and mouth, and we don't want to activate them, especially in your case right now. The other thing is, like he mentioned, like Dr. Kamath mentioned, no raw foods. I'm very emphatically saying that, and I've been advising this to also everyone else in the family that we should eat cooked vegetables, but you know we need enzymes, so there have to be half cooked vegetables and half cooked salads if we can eat. Fruits that we eat have to be peelable kind of fruits. So, you know, you can eat bananas, avoid grapes. You can eat oranges. You can eat papaya, which is actually also good for digestion. So these are on the contrary good habits, and any sort of meat you're eating has to be cooked. It can't be eaten raw at all. There's just no chance. Here are some points I have put together. For an easy reckoner is balanced meal. Proteins, of course, you can rely on. Paneer is excellent, excellent to form of protein for us. Curds, yogurts, these give whey. Eggs are excellent. The only thing we need to make sure that everyone are not easy on digesting eggs. So you might want to supplement yourself with enzymes, or at least eat them in quantities that you can actually digest. 1 to 2 eggs are actually good in your conditions because you are not like regular people who can eat from 2 to 4 eggs. Fish and nuts. Again, nuts, I would advise from a safety perspective, try to boil them up a little so that, you know, don't cook them, but boil them up a little and then eat them. Don't eat them raw. But fish and nuts and carbohydrates, focus on whole fiber and fruits. Avoid refined sugars, like I mentioned. And your plate should be 50% of fruits and vegetables. And herbs also, actually, some very essential ones like curcumin, which comes from turmeric, ginger, are actually very good herbs. And I will go over them very quickly in the next few slides. Avoid complex fibers. This is something we think that fibers, are considered to be great. Everyone is just emphasizing that. But in case of cancer patients, we need to avoid complex fibers. Soluble fibers are better choices. Also avoid too much of nuts. Again, don't eat too much in quantity, but nuts are good proteins. Beans, nuts, lentils, we need to restrict these also. It's not very easy to digest, including so proteins. We have to make sure that you eat it in, and I'll go with that ahead here. So proteins are extremely important because they play a great role in building our immune function and energy. Energy is needed. Instead of getting carbohydrate energy, if you're able to get protein energy, then proteins are also going to be utilized for recovery. But we need to don't shy away from carbs. We need to eat carbs because we need energy so that the proteins actually get utilized for the recovery process. Try eating small meals, 6 to 8. Why? Because you normally have nausea if you're going through chemotherapy. Most of you would know. So nausea and weight loss, these two can be taken care of. And we normally don't feel hungry. So, eating small meals are a better idea. And so why are we really emphasizing so much on nutrition? It is because cancer diagnosis, approximately 50% of patients present with some nutritional issues or the other. In certain cancers, about 85% of patients will develop malnutrition and weight loss during the treatment. And involuntary weight loss of 5% results in decreased survival rates. So this is very important. So which is why nutrition is so important. And these are the aspects which we need to focus on. Is muscle wasting happens, immunity building, so immune function is on a low. It needs to be built, and recovery and relapse has to be controlled. So those are the ones. And how do you, how to, the two most important things that I would mention is how to bolster your immune system in situations like these that we are facing right now is supplement your diet, because we are not able to eat this, that. There is always a fear, scare out of food safety. Supplements, on the contrary, are developed in a better fashion, and are also tested for all these things. So it's a better idea. Protein shakes with vitamin, minerals, and omega-3 are a good idea. And I'll quickly tell you why. And the other thing Dr. Kamath already mentioned, that we need to stay hydrated very much. So, about 4 glasses of water per day minimum. I think it should go over that. But again, drink it in smaller quantities so that you don't feel too full to eat anything. And when you eat proteins, it's critical to have the right amino acids. There are amino acids like arginine, glutamine, isoleucine, leucine, which are very important for recovery, for immunity and recovery both. And apart from that, the enzymes, which I always keep emphasizing, because whatever you eat doesn't get digested, especially in case of cancer patients. So, and normally our diets are higher on carbs and lower on protein. So, we have to make sure that all the carbohydrates that we eat are also digested well. Fiber is digested well. So I highly recommend supplementation of this. It's important to keep your gut health, because and how that can be done is by eating yogurts. Apple cider vinegar is also, but all these can't be had in very huge quantities. So what one can have is actually have probiotics and prebiotic combinations. The last few important ones are, like I said, herbs. So the boswellias sedata, which is normally eaten in the Indian context very normally, which is and Commiphora mucul, which are guggul's, two types of guggul's, ginger and turmeric. So these are actually the ones we need to focus on when it comes to keeping the anti-inflammatory responses down. So we could prevent further progression of the or also the relapse of the disease. In current conditions, a lot is spoken about zinc, vitamin C, iron, vitamin E, vitamin A, vitamin B6, vitamin D3 also. So there are combinations of vitamins and minerals that also need to be, of course, eaten through these variable different foods, but also can be supplemented. He did mention these two, which is why I've actually brought these two up. Is Vitaminolytes is one of the supplements which has most amount, which has not only the vitamins and minerals, but also has electrolytes to actually support your hydration. It does contain herbs like ginger, amla, tulsi, so and ashwagandha, which are very, very good in further progression of the disease. Also, apart from that, as I mentioned, a good protein formula is very important because it takes care of the immune function. It can help fight infections and also help in the recovery. If you have to be hospitalized for a surgery, it can actually it has studies have shown that there is a reduction in hospital stay. So that's really from my end, and uh, we will go over to quick questions if there are quite a few of them here. Uh, there is one specific question for us, and I will see on the screen. So here there's a question from we see Dr. Jeetan Bendur, and he's asking, is melatonin a part of your management regimen? Yeah.
Melatonin is a good drug, especially for those who can't sleep at
Yeah.
night and who have a lot of anxiety and all.
Mhm.
So we definitely use melatonin, but not for everyone, because one cost factor comes in the picture, and secondly, initial few stages, when they were given melatonin, those two people did not respond well. I don't know for what reason. So at the moment, we are using for few patients if possible, and it definitely benefits. It is useful drug.
Okay. I think that pretty much answers it. And I have a few more questions. One of the questions that came across, and I think because there are people who want to understand more about cancers, there's something which is called stage migration, and everyone's been talking about because they're not getting treated. Stage migration can happen. What does that what does the terminology actually mean, sir?
Stage migration basically means a patient has come today. He is in
Mhm.
stage one. Like I
Okay.
said, stage 0, stage 1, stage 2, stage 3, stage 4.
Yeah.
Now, that person, for whatever reason, is not getting the adequate treatment.
Yeah.
So automatically he gets upgraded. That is the sad part. So definitely the stage migration becomes from stage 0, 1, 2, 3, 4 if no adequate treatment is given, or no, what you call it, alternative therapy is given to the person. And if adequately treatment, the migration is the reverse way. So
Yeah.
from stage 3, they respond, and then they come to 2, 1 and recover. So both ways the migration is there, because we have a scale from 0 to 4, which swings like a pendulum, depending on what treatment the patient takes.
Yeah. Also, there is a question now. Normally, the when cancer patients are actually this going through the chemotherapy, etc. They already have some sort of infection going on, or maybe they'll have wheezing, etc. And these are symptoms which are similar to COVID. In those kind of scenarios, what should people do? Should they go ahead doing a COVID test, or instead not panic and be at home until unless the symptoms are not aggravating?
That's what I discussed in
Yeah.
the meet also.
Yeah.
Unfortunately, COVID and cancer chemotherapy side effect symptoms are the same. So
Yeah.
this is where the doctor involved is very important. So we have to see the WBC count, the lymphocyte count, and like I said, a CT scan of the chest.
Yes.
That becomes a very important tool in the present scenario. Initially, when there was no COVID, we would take it as a chemo reaction, no test of CT scan and all that done. So unfortunately, that is added. Second part, like you said, if symptomatic, COVID-19 will be repeated.
Yeah.
Nowadays, every patient gets a COVID-19 done before chemo, and chemo is started after it is negative. Now, how frequently to repeat and all that is very difficult to say because it's not a cost-effective test. It's 4,500 rupees additional burden. That is the other thing with chemotherapy, slight increase in costing as effort because all of medical staff also has to wear the PPE. There are no general wards. There are only single rooms. So all these things slightly escalate the chemotherapy costing. There is no doubt about it. But we have to fight the disease and sail across over a period of time.
Yeah. Very, very tough situation that all of us are experiencing. And I think being probably mentally strong is, I think, probably the most important thing which can happen right now. Probably on a positive side, because, now not many people are going around here and there. I think the patients are probably less subjected to too many other infections. Could that be the case? Because already other infections probably are a
Yeah,
little on the lower side in February, March in India
definitely.
or in the current weather conditions.
Yes, yes,
So,
definitely. Because, like I said, COVID causes problems, there's no doubt. But because of COVID, a lot of things good have happened.
yeah,
We'll not go into this because we're not going to discuss in it. One of the
yeah,
most important is the non-cancer.
yeah,
Uh, Total zero railway accident till 2 weeks ago.
yeah,
And road
right,
traffic accidents came down drastically till 1 week ago. And
yeah.
now it has opened a little bit and both of them have already started. That's the sad part.
Yeah. So while that is happening, I mean, the only thing I can see, when we are not able to give a chemo, are there any specific drugs that you're putting your patients on, or are you relying a lot on the nutrition or the therapeutic nutrition, which we call the nutraceuticals?
Okay, see, basically it depends on the disease, but oral capsatabine and oral tablet methotrexate and other oral tablets, depending on the disease, are being preferred over
Mhm.
IV, depending on the disease.
Okay.
Even HER2 positive patients and all, we are preferring oral therapies if possible. But
Okay.
if the patient can come, they are fit, they don't have comorbidity, we are giving chemotherapy and the other necessary drugs as per protocol with proper care.
Yeah. One another important question is, are you giving any sort of, are you suggesting any sort of antivirals or antibiotics so that, as a preventive treatment, was another question. I think it's very related to what you answered right now, but an antiviral or antibiotic, like,
We
most of the healthcare workers are taking um, uh, drugs for prevention. Are that recommended here?
see for chemotherapy, we are only using our initial antifungal and antiviral, which is for herpes.
Yeah.
But for COVID, we are not prescribing as of now because no is documented benefit in prevention for such a person. Because this person, even if he comes to the hospital, is going to come only once, he will be isolated properly and he will be leaving immediately.
Yeah.
So those drugs which we give, HCQ, what you're saying, or any
Yeah.
other drug which we give, they have their own side effects. These patients are already on drugs which have cardiac side effects. So if HCQ is added to that, they may have ventricular QT interval changes and they may develop an heart attack and all that. So preventive medication for COVID from allopathy point of view, we are not giving. Nowadays,
Yeah.
people are suggesting homeopathic medication and all that. That's an individual choice. But most important is hand washing. One should remember these two hands have to be cleaned, cleaned and cleaned and cleaned and cleaned. The other thing is not to touch your face.
Yeah.
When you are out, everything, without washing your hands, you should not touch your face. Uh, See, you catch the lift, avoid the lift. If you can walk, catch the staircase. Don't touch the rods. When you're walking or sitting in the bus and all, keep your hands folded. So it should not touch the railings. So basically, you become fit individual. Like our PM said, Atmanirbhar. You have to be Atmanirbhar on yourself to do everything yourself. Don't expect other to help you out and all that. It is that way. So it's in a different technology, I said. But we have to be Atmanirbhar. Avoid lift. If you are on the first floor, second floor, third floor, of course you will require use the lift and use tissue paper to press the button. As you get down, clean the button. Simple precautions have to be
Yeah.
taken. Most important is relatives and visitors to the minimum. We are basically very social people. We like to meet, we like to interact and talk to each other, and there's nothing wrong. That's our life. We are social animals. But that is the most important curtailment for the moment, and which is going to last for some time. I had a photo just now. I could
Mhm.
not somehow load it. The future, what headgears we are going to wear. Just now, a designer has brought out a beautiful headgear with the parda. So all of us will be wearing that and moving around, I think, when the time comes out.
Right. Yeah, and so also we have to. That's why I remember viewers that we have to stay at home, and for and especially if there are patients at home, we will have to stay at home. We don't have a choice. Try as much to get essentials from outside, take help from outside, and food safety is extremely paranoid and important. I think people who are unaware about this, and day in and day out, I get it's like that I'm getting panic attacks at my house because I do understand so much about food safety, but uh, don't panic, but keep your food as safe as much as you can, and don't eat uh, anything heated without heating up, or heated up food. So with we have to take that much of care, and we have to stay home for these kind of patients. The earlier the lockdown ends, the earlier these people are going to be able to get treatment. They are at our mercy right now, and really hard goes for them because they are not able to get treatment because we are not ready to sit at home. I know, Dr. Kamath, you also had one or two points to say about the social distancing, or the way the whole social scenario should be. You can actually feel free to make your comments on that front as well.
No, no, basic social distancing, so definitely true. I would suggest that it is not social distancing, it should be physical distancing. We are socially have to be together, but
Correct.
physical distance of 6 feet between each other. One cannot be socially distant. Should not forget that we are still friends, we are still neighbors, we are still staying in the same society, we are still saying we have to be socially one. One cannot be socially distant. We have to be socially one. So the sad part, some societies and everyone unfortunately have the myth that a healthcare worker, a doctor or a nurse or someone who's working outside and then they come to the society, they are blocking their entry in the society. That should not happen because the doctors and everyone are taking full precautions when they manage the patient. It would be very easy for the doctor to just stay home and be quarantined, not do anything. But then who will treat the patient? One should not forget that. One has to respect the doctor and the healthcare workers and all the professionals, even police and everyone. They are working day in and day out to maintain the sanctity and avoid this infection. The doctors and healthcare workers are also doing a lot in the house. Let me be very frank. We doctors, like I said, are exposed maximum to the risk. We are sitting like a spacesuit. It's not easy to wear that spacesuit. We sweat like anything and we are exhausted by the time we finish the operation or everything and we come back home. At home also, as far as possible, we isolate ourselves from our family. I'll be very frank. Those who work in the COVID wards, they don't come home for 14 days. They stay alone in the hotel or somewhere, and they don't come home in 14 days. When they're asymptomatic, only then they come home. Even for us, we maintain our distance from our children. Since we have started treatment, we have not hugged our children and maintained distance from them, so that we don't want them to be affected. Our mothers, our mother-in-law and all, we have to maintain that physical distancing. That is the sad part. But we are sacrificing all that for the betterment of the society. And this is where we expect the society to be a little bit sensible and don't create unnecessary hassles in the traveling of the healthcare worker or the doctor in the premises. Don't be in the wrong myth that the doctor or the healthcare worker is bringing the virus in the society. It is not that way. If the doctor or someone is symptomatic, he will definitely get treated. It is not that they don't like that person also wants to be fit and fine. One should not forget that. So this thing I am saying, uh, being against anti-healthcare workers is not right. In fact, the latest government rule just announced 3 days ago is a asymptomatic positive patient. Let me be very frank, mention you. A
Mhm.
symptomatic COVID positive patient can also stay in his own house. So now you have to allow even a COVID-19 patient in the house when he is positive, if he is asymptomatic. So
Yeah.
please change your mindset, accept the change. And this is not a change for just a week or so. This is next, it's a war, like I said. It is except that we can't see the enemy.
I think that's we're already over an hour. We just didn't even realize that
Yes, yeah.
while being with you, and a lot of intricate insights, information that you gave us. I think for us, I think that way COVID has been a blessing in disguise, because we are able to get this time from doctors like you, who are otherwise always on your run, trying to treat patients, and doing complex surgeries as well. And I know personally that you're known to do the high risk surgeries, and you take your risks, and that's really commendable a task. And doctors like you are actually trying to protect yourself, so that you will be there for your patients, and even when you visit them, you're taking every precaution so that you don't spread anything to them, and when you come home, you don't spread anything to your family members, which actually includes your building and your apartment complex, and your neighbors. They are all our family. So that's how doctors treat their neighbors and families. So I would, if I was there, I would do the same. And absolutely right, like you said, even a COVID patient need not go out, because we don't have that much of infrastructure now for them to go out, and they would probably have to contest more infections going out to hospitals. So totally, all points taken from you, and a great informative lecture. I don't think this is only for lockdown. It's going to stay with us for longer. And I'm sure we will come back to you with more specific cancers, and getting more information on GI cancers, especially colon cancers, pancreatic cancers. How do we actually address them, and how the surgeries are done? So we look forward to hearing more from you soon. And viewers, hopefully you had a great show. If you want to say something for a minute, sir, I would let you, and I'll close it there then.
So thank you very much. I hope it was informative. And if you have any more questions or queries, you're free to ask in my private chat also. That is not a problem. We are always there for you. And that's it. Thank you. Stay safe, wear a mask, wash your hands. That's important.
So with that, we come to the end of this Facebook Live. We'll try to see if we are getting this offline. Just a minute. Going back to the mask. Can you end the live? Have you ended the live? You have ended the live? Hello? Do it.
Okay, we're live now. Meeting. Meeting.
Hello, viewers. Welcome to one more show of Truwellth Facebook Live. Um, I'm, of course, here with popular demand with Dr. Satish Kamath, and I'm giving you a quick introduction about our show as well as Truwellth. Um, it is a COVID lockdown, and with popular demand, we have really called Dr. Satish Kamath back onto one individual show as cancer and chemotherapy, or in treatment and palliative treatment around the disease, is the most difficult and anxious time for the cancer patients, and of course also for the doctors who are treating them. Um, that is why he is really here to tell us more as to how we can take care of the cancer patients and manage through their chemotherapy appointments and schedules. Just to give you a little bit about Truwellth, Truwellth is an integrative healthcare initiative guiding patients and healthy individuals to overcome the health concerns and manage their self-help to reach the ultimate goal of holistic health and happiness. Truwellth aims to help you separate science from hype by sharing